Coming up, we'll be on location at the Oral and Facial Surgery Center of Virginia, discussing the latest advances in dental implants and how they can change your life by restoring your smile and your functionality with one of this area's top oral surgeons, Dr. Hasnain Shinwari. Welcome, Dr. Shinwari. It's a pleasure to have you on the Top Doctors Interviews program.
Thank you for having me, Nick.
All right, it's our pleasure. Dr. Shinwari, you've established a wonderful reputation for excellence throughout the Virginia area, not only for dental implants, but also for oral surgery and patient care throughout the region. Can you please share with us about your vision for the practice and what you feel separates you from other oral surgeons in the region?
Yes, Nick. If you needed a surgical procedure in your area, you will research for a top surgeon in your area, and you will pick a surgeon that does that kind of procedure on a frequent basis. I'll give you an example. If you needed a heart valve replacement, you will look for a cardiac surgeon who does valve replacements on a daily basis. At Oral and Facial Surgery Center of Virginia, we do dental implants, bone regeneration procedures on a daily basis. I think that's what sets us apart from other people. I understand implants are placed by many practitioners. General dentists are placing implants as well. Some are more proficient than others. But what if something goes wrong, or your case ends up being more complex than originally anticipated? That's why you need to be in the care of a specialist. As an oral surgeon, you go through extensive training in oral and maxillofacial surgery, and that's after dental school. That is followed by certification by the American Board of Oral and Maxillofacial Surgery. At Oral and Facial Surgery of Central Virginia, we have experienced staff. They know what they're doing, and they will really take care of you.
That's a great point, Dr. Shinwari. To be a specialist, I mean, this is what you focus on. This is where you have all that extensive training. It really is a great idea for people to go to a board-certified oral surgeon like yourself, because this is really what you do best. So, Dr. Shinwari, I'd like to talk about dental implants, because so many people experience missing teeth, cracked teeth, or need dental implants for various reasons. So we wanted to begin by asking you what dental implants are.
A dental implant is a surgical post that is implanted surgically in a jawbone, to which an artificial tooth is then attached after a brief period of healing. There are two different indications for implants. There's one where we use dental implants for a single or a few missing teeth, or we can use dental implants to replace dentition in the mouth, which is also called teeth in a day. There are different names for it. So those are the two types of dental implant procedures.
And what types of problems do dental implants typically address?
Dental implants can give you a aesthetically pleasing smile and restore functionality of your teeth. So you can enjoy the things that you normally do, chewing, eating food, kind of food that you like to eat. It looks and feels natural. And if you have dentures, it can also provide dentures that are fixated to the implants.
So there's many benefits from dental implants, and those are very important.
That is correct. Implants can revolutionize somebody's life. It is a very rewarding procedure. We get compliments from our patients, and they tell us the difference it makes in their lives. Both from the cosmetic and the functional point of view, it's life-changing experience.
And who would you say is a good candidate to get dental implants?
Dental implants is an ideal solution for anybody above age 18 who is having issues such as missing teeth or decayed teeth. They are ideal candidates. However, there is a treatment planning process that goes before we can decide if somebody would be a good candidate. That involves getting a cone beam CT scan and evaluating the jawbone to see if we have the available bone to place the implants.
It seems like dental implants can help so many people. Can you tell us who a good candidate is for the dental implant placement?
Dental implants can be offered to almost anybody who wants to restore their dentition or have teeth that have better chewing ability. However, the jawbone has to be fully developed.
So Dr. Shinwari, you mentioned that there's two different types of dental implants. There's teeth in a day, and then there's also dental implants for single or multiple missing teeth. Can you tell us about the patient process for each of those?
The process starts with a consultation appointment where we examine the patient and get a CT scan. In the CT scan, we evaluate the jawbone in a 3D view, and we see the amount of bone that's available. In the teeth in a day, is in that process we place several implants in the jawbone, and teeth are then artificial teeth that are attached to the implants. So the patients, after the procedure, they walk out of the office with a full set of teeth. Dental implants for single or multiple teeth involves 2 surgical appointments. In the first appointment, a dental implant is placed in the jawbone, and after the healing, a second surgical procedure sometimes is done to uncover the implants.
So after patients get dental implants, is there any downtime for the patients?
There is a healing time. Normally patients are recover full function in after 1 week with some limitations.
So what kind of results are your patients seeing, Dr. Shinwari?
It's a life-changing experience for many patients. A lot of our patients, when they first come here, they have either inability to chew food, or they do not like their smile. And some of them tell me that they haven't smiled in a long time just because they were so embarrassed about their teeth. Having a teeth in a day changes that. When they, after the procedure, they're able to smile, that affects their self-confidence, and their ability to chew food is remarkable, and it's a life-changing experience for all of them.
That's great, because being able to eat the food that you like to eat, being able to smile, I mean, these are very important parts of our life that make us feel better and really enhance our life experience. So dental implants are very important. Can you tell us how long dental implants typically last?
As long as they take care of the implants, such as cleaning, regular hygiene appointments, it can last them a lifetime.
And that's not any different than your natural teeth that you would have to maintain and take care of
That is correct.
and get your cleanings and your checkups, right?
That is correct. That is correct, yes.
Now, are dental implants covered by insurance, Dr. Shinwari?
Yes, most dental insurances do cover implants.
So that's really good to know, because that way it helps people with their out-of-pocket cost when their insurance covers it.
That is correct. And this is determined at the time of their consultation. We get a predetermination from the insurance, so the patient is aware how much insurance is going to cover and what their out-of-pocket benefit is going to be. So for those of the patients who do not have dental insurances, we provide them a global fee, and we work with third-party financing services that can help them to get the treatment that's needed.
That's wonderful. That can really help so many people, whether it's covering through their insurance, you offer the financing through the third-party company. Either way, dental implants seem to be a really important factor that's helping people with their eating, their smiles, restoring lives as well. So, Dr. Shinwari, that was very informative. I want to thank you so much for joining us and being a guest today on our program.
Well, thank you, Nick, for having me.
I came here to see Dr. Shinwari because I had a bridge in my mouth, in the bottom part of my mouth, and it broke off. It was like a 6-tooth bridge. Then I was not going out much at all and very self-conscious about it. Dr. Shinwari explained everything to me as far as the process, and he made me feel comfortable. He has a great personality. I felt that I could trust him, which is again why I came here to begin with. The day that I came here, I was very ready to have the procedure done because I knew I was in trusted hands. And I was just so pleased once I had the surgery done. Coming here with without teeth on the bottom, and to have the implants put in, and shortly thereafter to have the temporary teeth put on, I mean, in a short period of time to have all of this done, it is truly life-changing. I'm just glad to have teeth because for a while I was walking around with no teeth on the bottom. You know, I can smile and be myself once again, and I'm so pleased and grateful for this experience.
Well, I've been having trouble with my teeth most of my life, and I had lost a number of them back during our military days years ago, and I'd had some of them replaced with caps, and they started shifting and falling out, and I got tired of having them glued back in, so I decided before I retired that it was time to go in and have the implants put in. It was a really quick process considering the amount of surgery I had done. I was in and out of here in about 3 hours. So, and I haven't had any problems with them. It was a little painful afterwards, and it was a little swollen, and there was some bruising, but it went away within a few days, and I've been fine ever since. He was very good with me. He explained everything in detail, both to myself and to my husband, for my aftercare and what to expect in the coming weeks. They were all great. I mean, they've all been very helpful. They're all really nice people, very easy to deal with. I would highly recommend Dr. Shinwari. He has given me a really good experience here.